Imagine a fire alarm going off in your house, but there is absolutely no smoke anywhere.
Right, just a loud, persistent ringing that you just can't quite locate.
Exactly. So you assume it's a glitch. I mean, you reset it, you try to ignore it,
Mhm.
but it keeps going off, and mostly at night.
And because you can't actually see the fire, you just sort of learn to live with the noise. Or, well, you try a dozen quick fixes that just don't work.
Right, and that is incredibly dangerous because the fire is actually there. It's just burning inside the walls where you can't see it yet.
Yeah, that invisible fire is a perfect way to describe what we're dealing with today.
It really is. So welcome to the deep dive. Today we're taking you through a stack of medical guidelines, patient information leaflets, and clinical resources from major dermatology and gynecology associations.
All focusing on a specific condition called lichen sclerosus, or LS for short.
Right, LS. And our mission here today is highly specific. We are going to isolate and really unpack the very first signs and symptoms of LS.
Because establishing exactly what to look for early on is, well, it's the absolute key here.
Yeah, for sure.
I mean, this is a chronic inflammatory skin condition that is frequently misunderstood. It's chronically misdiagnosed, or people just suffer with it in total silence.
Which is heartbreaking.
It is. So, knowing the early warning signs is really the only way to prevent severe, long-term physical and, honestly, emotional distress for you or someone you know.
Okay, so let's start at the very beginning, before anything is even visibly wrong. What does the patient actually feel?
Right.
Looking across all these clinical sources we have, the most common early physical symptom is intense itching.
Yeah, the medical literature calls it pruritus.
Pruritus, okay.
Okay.
And it is overwhelmingly reported to be significantly worse at night.
Yes, very common.
And this is usually accompanied by a general soreness, burning, and this extreme sensitivity to friction. But, wait, if I'm looking at this critically, an itch and some soreness, couldn't that just be, I don't know, dry skin?
Oh, absolutely. That's what most people think.
Right. We're like chafing from tight exercise clothes. Or
Yeah.
even just a common yeast infection like thrush.
Yeah.
I mean, it sounds exactly like an irritating clothing tag on the back of your shirt.
Yeah.
It's a minor, everyday annoyance that is just incredibly easy to dismiss.
It is entirely understandable why people dismiss it, and to be fair, why even general practitioners sometimes misdiagnose it at first glance.
Oh, really? Even doctors?
Oh, yeah. But to understand why it's not just a yeast infection, we have to look at the underlying mechanism.
Okay.
Lichen sclerosus is a chronic inflammatory condition, and the current medical consensus strongly points to it being an autoimmune response.
Oh, wow. Okay.
Yeah. So the body's immune system is mistakenly attacking its own normal, healthy tissues.
So this isn't a bug you caught at the gym.
Not at all. It is not an infection. It is definitely not contagious. You cannot spread it, and it has absolutely nothing to do with poor personal hygiene.
That's a huge misconception, I'm sure.
Massive. So when you feel that intense itch, you aren't feeling a surface level irritation from chafing or a topical fungus. You're feeling a symptom of active, aggressive inflammation occurring deep within the lower layers of the skin.
Okay, so if the inflammation is happening deep down, it's kind of like having termites in the walls of a house.
Oh, I like that analogy.
Right. Like the outside paint might look completely fine for a while, but those termites are actively eating away at the structural support.
Exactly.
So by the time you actually notice the floorboards dipping, or in this case, the skin changing, the foundation is already heavily compromised.
That is a brilliant analogy. The immune cells are the termites.
Wow.
And because it's an autoimmune response driven by internal mechanisms, those standard over-the-counter treatments for thrush or generic anti-itch cream,
They might do anything.
they are completely useless for extinguishing that fire. I mean, they might offer a momentary cooling sensation on the surface, you know?
Yeah, just masking it.
Right, but the termites are still eating the wood underneath. The inflammation just marches on.
So if the creams aren't working because the fire is underground, the patient eventually starts looking closer, or they go to a doctor to figure out what's really wrong.
Yeah.
But if there's no obvious rash like you'd get with, say, poison ivy, what is the doctor actually looking for?
Well, because the physical sensations can be written off, the true confirmation of early LS relies on highly specific visual clues.
Okay, so what are they?
You really have to know what you are looking for because the visual changes in those early stages can be incredibly subtle. The doctor is basically looking for the structural damage left behind by that deep inflammation.
Right, so the clinical guidelines we're looking at describe the earliest visible changes as these well-defined porcelain white, shiny patches or plaques.
Yes.
And the skin itself starts to look distinctly thin, pale and slightly wrinkled. But wait, I'm confused here.
What's that?
If the immune system is down there causing massive inflammation, shouldn't the skin be bright red, swollen, and like hot to the touch?
You would think so, yes.
Yeah, why does it turn pale, white, and thin? That seems completely backward for an inflammatory response.
It does seem counterintuitive, but it makes sense when you look at what the immune system is actually destroying.
Okay.
In lichen sclerosus, the immune cells aren't just causing general swelling, they are actively damaging the melanocytes.
The pigment cells.
Right, the cells that give skin its color. So
Right.
that causes that porcelain white pallor.
Oh, okay.
And even more critically, they are attacking the collagen and elastin in the dermis.
Which is the scaffolding of the skin.
Exactly. When you lose that underlying support, the skin physically thins out.
Wow, which completely explains the texture, because the clinical guidelines, they famously describe this as having a delicate cigarette paper texture.
Yes, that's the classic term. The skin loses its elasticity and thickness, and it takes on that really fragile, crinkled appearance.
That is such a vivid visual.
It is. In fact, sometimes the very first signs aren't even fully formed white patches yet. It might just be a general localized pallor and a slight edema.
Edema, like fluid swelling.
Right, fluid swelling right below that thinned out layer.
Okay, and we really need to clarify where this is happening. The sources are clear that while LS can appear elsewhere, it most commonly affects the genital skin.
Very true.
We're talking primarily about the vulva and the perianal skin. And the sources mention that when it affects both areas, when it circles the vulva and the anus, it creates a very specific shape.
Dermatologists call it the figure of 8 pattern.
The figure of 8.
Yeah, it's a very distinct visual marker.
And that's where a dermatologist's detective work comes in, right?
Right?
Because a lot of things can make you itch down there, and they have to basically rule them out one by one.
Oh, absolutely.
So if a patient comes in with a severe itch in a figure of 8 pattern, how do they know it's lichen sclerosus and not some other severe skin condition?
It's all about the visual fingerprints of the structural damage, like we mentioned.
Okay, give me an example.
For instance, if a patient has been suffering from a chronic itch and has been, violently scratching the area for months.
Which happens.
Right. The skin typically responds by becoming thickened, dark, and leathery to protect itself.
Oh, okay.
And that points to a condition called lichen simplex chronicus.
Oh, I see, because LS does the exact opposite.
Oh.
It makes the skin thinner and paler, not thicker and darker.
Precisely. The doctor is looking at the mechanism of change.
Right.
Alternatively, if they see red plaques with thick, silvery scales, that's the classic presentation of psoriasis.
Okay.
Or if the skin is acutely bright red and covered in fluid-filled blisters, they're likely looking at contact dermatitis.
Like an allergic reaction to a new laundry detergent or
Yeah.
a synthetic textile dye, right?
Exactly. The porcelain white color and that unique crinkled cigarette paper texture are the true hallmarks of early lichen sclerosus.
So spotting these delicate white cigarette paper patches early is basically the entire ballgame here.
It really is.
Because you have this incredibly fragile, paper-thin skin in an area of the body that is constantly subjected to movement, friction, and moisture. And if it's left vulnerable and untreated, the simple actions of everyday life will just cause the symptoms to escalate. And the sources describe this escalation as quite violent.
Very much so. The underlying inflammation sets the stage, but the environment pulls the trigger.
Wow.
And this brings up a critical clinical concept known as the Koebner response.
Okay, yes, I was reading about this in the dermatology guidelines. The Koebner response.
Right.
That basically means that friction or minor mechanical damage to the skin doesn't just hurt, right? It actually triggers the lichen sclerosus to spread or makes the existing patches significantly worse.
Exactly.
It's almost like the disease feeds on the trauma.
That's a highly accurate way to frame it.
Yeah.
Think back to our termite analogy.
Right.
The scaffolding of the skin, the collagen and elastin, is already heavily compromised by the autoimmune attack. So the skin has basically zero tensile strength left.
It's just so weak.
Exactly. So when you introduce routine mechanical stress to that fragile cigarette paper skin, it physically cannot hold itself together.
And we aren't talking about major physical trauma here.
No, not at all.
We are talking about the friction from simply walking in jeans,
Right.
the repetitive rubbing of a panty liner, minor urine leakage. I mean, even just regular wiping with toilet paper becomes a destructive act.
It really does. Normal daily activities become tissue-destroying events.
That is terrifying.
Because the skin lacks elasticity, this everyday friction leads to tiny, agonizing cracks in the skin called fissures.
Fissures, okay.
Yeah, the skin tears with almost zero resistance. And you will also frequently see the appearance of tiny purple blood blisters, known medically as purpura.
Okay, let's break down the purpura for a second, because that sounds terrifying to suddenly discover. That's essentially internal bleeding right at the surface, right?
Yes, that's a good way to look at it. The small blood vessels right under that thin skin lose their protective padding.
Oh, because the collagen is gone.
Right. So
Yeah.
the friction from just sitting down or liping can cause those tiny vessels to rupture, and that pools blood right under the translucent skin.
Okay, I really want to make sure we are conveying the stakes of this deep dive for you listening.
So important.
If you're taking notes, why is it an absolute medical emergency to catch this at the initial white patch and itch stage before it progresses to the tearing, the fissures, and the purpura? Like, what does this mean for a patient long-term if they just keep trying to treat it with yeast infection cream?
The consequences of missing that early window are severe, and they're largely irreversible.
Irreversible.
Wow. Yes. If lichen sclerosus is not caught and treated aggressively early on, typically with a regimen of ultra-potent topical steroid ointments like clobetasol propionate,
Right.
if that doesn't happen, the persistent inflammation causes permanent architectural changes to the body.
Architectural change. I mean, that's a very clinical way of saying it literally alters your anatomy.
It does. As the body constantly tries and fails to heal these recurrent fissures and tears, it lays down heavy scar tissue.
Okay.
This scarring can cause the labia minora to shrink and eventually fuse together completely.
Oh, my goodness.
The clitoris can become buried under a thick hood of scar tissue, completely hiding it. And the entrance to the vagina can narrow so significantly that it loses all elasticity.
That sounds unimaginably painful. You're talking about a loss of fundamental bodily functions here.
Exactly. It makes sexual intimacy excruciatingly painful and eventually physically impossible.
Wow.
It can even make simple urination a painful ordeal if the scarring alters the urethral opening.
So catching it at the white patch stage isn't just about managing an annoying itch.
No, not at all.
It is strictly about preserving the patient's bodily function, their anatomy, and just their overall quality of life.
100%. And beyond the architectural damage, there is another major medical reason to catch it early.
Right. The sources highlight a direct connection to cancer.
Yes. Having lichen sclerosus carries a small but very real increased risk of developing squamous cell skin cancer in the affected area.
Which is incredibly serious.
It is. The risk is estimated to be under 5%, but because the consequences are so high, regular lifelong clinical monitoring is mandatory once you're diagnosed.
Wait, does the steroid treatment help prevent the cancer, or does it just treat the itch?
Well, current clinical thought suggests that getting the inflammation firmly under control with topical steroids may actually reduce that malignant potential.
Really? How so?
Because chronic unchecked inflammation is what drives cellular mutation.
Oh, that makes sense.
Yeah, by halting the immune attack early, you aren't just saving the tissue structure, you are potentially lowering the risk of those cells turning cancerous down the line.
That's a massive benefit.
Plus, a patient who knows they have LS will actually be looking for those early warning signs of cancer-like non-healing ulcers or sudden lumps.
Right, whereas someone suffering in silence will just miss them completely.
Exactly.
Okay, so we've painted a fairly intense, sobering picture of how this affects adult women.
We have, yeah.
But looking deeper into these guidelines, there is a massive misconception that this is exclusively a postmenopausal woman's disease.
It's a huge myth.
Lichen sclerosus doesn't just affect one specific demographic,
Yeah.
and assuming it does, leads to a really dangerous blind spot in medicine.
Relying on demographic stereotypes is exactly why so many patients go years without a proper diagnosis.
For sure. For instance, let's talk about children.
Okay.
The British Association of Dermatologists leaflet explicitly notes that up to 15% of all cases occur in children, usually starting long before puberty.
Yes, that surprises a lot of people.
And there is a highly surprising early symptom in young girls that parents, and honestly even pediatricians, might completely misinterpret.
You're referring to the high incidence of severe constipation.
Yes, constipation. When I first read that, I had to double-check the source.
I don't blame you.
Why on earth would a skin condition cause constipation in a child?
Well, it goes right back to that figure of 8 pattern and the Kubner response we discussed earlier.
Right.
When lichen sclerosus affects the perianal skin around the anus in a young girl, that skin becomes fragile, inflamed, and prone to those microscopic agonizing
Oh,
fissures.
I see. So passing a bowel movement physically stretches that damaged skin.
Exactly, causing a tearing pain.
Wow.
The pain is so severe that the child subconsciously begins holding in their bowel movements to avoid it.
That is so sad.
It is. So the constipation isn't a gastrointestinal issue at all.
Right.
It's a behavioral response to the trauma of the skin condition.
Think about the psychological horror of that for a parent. I mean, your child is crying on the toilet, complaining of stomach pain. You take them to the pediatrician.
And what does the doctor do?
The doctor asks about their diet, tells you they need more fiber, and prescribes strong laxatives.
Okay.
But the child is still in agony, and
Yeah.
no one is looking at the skin because a chronic autoimmune vulval condition isn't on the radar for a 7-year-old.
It's a tragic cascade of misdiagnosis. And, well, the darker side of this is the presence of those purpura.
The tiny purple blood blisters caused by friction.
Yes. If a doctor does finally examine the genital area of a child and sees what looks like tearing and bruising, and they don't know the visual signs of early lichen sclerosus,
Oh, no.
they may mistakenly suspect sexual abuse.
Wow. That is just devastating.
It really highlights why comprehensive clinical awareness of these early signs across all ages is absolutely vital.
Absolutely. And, it affects men too.
Yes, it does.
The sources mentioned that in men, it can present on the penis as a severe tightening of the foreskin and painful erections.
Right.
Again, it entirely mimics other structural urological issues if the doctor doesn't know to look for those specific porcelain white crinkled patches.
The exact same autoimmune pathology manifests in wildly different functional ways depending on the anatomy it attacks.
That is so wild. And speaking of different anatomy, we have to talk about extragenital lichen sclerosus,
Oh, yes.
because this part of the research genuinely blew my mind.
it's fascinating.
In a minority of people, LS appears on non-genital skin.
Mhm.
We're talking about the waist, the shoulders, under the breast.
Right.
And it looks identical visually. It's those porcelain white, wrinkled cigarette paper patches.
Yeah.
But there is a massive, baffling paradox here.
Yes, the complete absence of symptoms.
Yes. Unlike the genital version, which we've established causes agonizing itching, burning, tearing, and this life-altering pain,
Yeah.
these extragenital white patches are usually completely silent.
Totally sad.
They don't itch. They don't hurt at all.
It is one of the most striking contradictions in dermatology.
But how is that possible? I mean, it's the exact same autoimmune condition.
It is.
The exact same immune cells acting like termites, destroying the collagen and thinning the skin. Why is it a totally painless curiosity on your shoulder,
Yeah.
but an absolute waking nightmare on the vulva?
Well, the medical literature doesn't have one single definitive answer for why the symptom profile shifts so drastically.
Okay.
However, it largely comes down to the environmental and structural differences of the tissue itself.
How so?
Genital skin is structurally different. It has a significantly higher density of nerve endings, making it infinitely more sensitive to inflammatory signals.
That makes sense.
Furthermore, genital skin is subjected to constant occlusion.
Meaning it's trapped under clothes.
Right. High moisture, acidic fluids like urine, and relentless daily friction.
So the shoulder patch is just sort of existing in a dry, low-friction environment,
Exactly.
whereas the genital patch is basically sitting in a war zone.
That's a great way to put it. The shoulder isn't subjected to the Koebner response in the same way at all.
Wow.
And this wide variance in presentation is exactly why diagnosing this condition requires looking at the whole picture.
Right.
I mean, a general practitioner might casually note a white patch on a patient's back during a routine checkup and think nothing of it.
Thinks it doesn't hurt.
Right, completely unaware that it's the exact same systemic disease causing the patient's so-called incurable yeast infection down below.
That is just incredible. So as we bring all of these clinical puzzle pieces together, let's distill the core takeaways for you listening.
Good idea.
If you take away nothing else from this deep dive into the sources today, remember this. The earliest signs of lichen sclerosus are not just a bit of dry skin or poor hygiene.
No.
It starts with an intense, unexplainable itch, typically far worse at night, and an extreme sensitivity to friction.
Right, that itch is the fire alarm. It signals deep structural inflammation.
Exactly.
And visually, you are looking for porcelain white, shiny patches of skin that look unnaturally pale and thin.
That classic, delicate, cigarette paper texture.
Yes.
And if those patches form a figure of 8 around the genitals and anus, you need to seek out a specialist, like a dermatologist or a gynecologist experienced in vulval dermatosis, for a clinical diagnosis.
Definitely. Do not wait for the skin to start tearing, blistering, or causing severe pain.
Right? Catching it at the silent white patch stage is the difference between applying a safe, highly effective topical steroid ointment to manage the termites and dealing with permanent, irreversible anatomical changes.
Because knowledge really is the most valuable tool a patient can have.
It really is.
Once the mechanism is understood, it can be managed. The ultra-potent treatments we have today are remarkably effective at halting the disease process and preventing scarring.
Provided they are applied correctly and early enough.
Exactly.
Which leaves us with a final thought to mull over, building on everything we've read in these clinical guidelines today.
Okay.
Consider the profound psychological weight of a condition like lichen sclerosus.
It's massive.
It's an autoimmune disease that cleverly mimics minor, everyday infections. It physically destroys and alters human anatomy.
Yeah.
It deeply affects a person's ability to be intimate, and in children, it can cause agonizing behavioral issues.
It touches every part of life.
It does. Yet the biggest barrier to early detection might not actually be the subtlety of the white patches or the silent symptoms.
No, the biggest barrier is the cultural environment we live in.
Exactly. It's the societal silence and the intense, paralyzing stigma surrounding genital health.
That stigma is the real enemy.
It is what keeps people suffering in the dark, buying over-the-counter yeast infection creams for years,
Yeah.
and keeping them from simply asking their doctors about that invisible itch in the first place out of sheer embarrassment.
It's tragic.
It is. If we can drop the stigma and talk about the symptoms openly, we can finally help people put the fire out before the house burns down.